Welcome back to Idaho Today. You know, choosing the right health insurance plan is not only important, it's personal. And now is the time to make changes or choose a health insurance plan for you and your family. You may be searching for answers or additional resources to inform your decision, and SelectHealth can help. So we're joined today by Trent Nate to tell us more. So great to see you, Trent.
Happy to be here. Thanks, Melissa.
All right,
Glad
so
you had me back.
yeah, it's great to have you back, right? Well, because we want to make sure that everyone's making the right decision for themselves and their families too as they head into the year. All right, so open enrollment has begun.
Has.
Yes, but what do people really need to keep in mind when it comes to picking their health plan for 2023? There's some dates and deadlines in particular they really need to pay attention to, right?
So it actually began earlier this year on October 15th, which gives people a little extra time. At this point, really the main date to keep in mind is December 15th. Plan choice needs to be made prior to the 15th of December to ensure that you have coverage for January 1st of 2023.
All right, so make sure that they're putting this down on their calendar.
Absolutely.
Setting little reminders on their smartphones. Don't want to miss those dates.
Yep.
And then when it comes to some of the plan options this year, what should they be keeping in mind? What should they evaluate?
Yeah, I think this is a great opportunity every year to look at what you have and then also explore what other options are available. Of course, if you like your plan, you like your coverage, there's really nothing you have to do. But again, it's a good time to evaluate. And there's really a series of things that we recommend taking a look at. The first one is to look at what subsidies are available to lower your monthly premium. We still have what are called advance subsidies through some legislation that was passed that year that will go into the following year, which is great. And then there's also some additional subsidies that are available specifically for dependents on employer sponsored coverage. So want to look at subsidies first and foremost. The second thing is to look at what networks would be available by plan option. Most plans are affiliated with a specific network, and so you want to make sure that your doctors are in that network. Once you've got your subsidy and your network defined, we really recommend that if you're taking any prescriptions, to make sure that you look at how those are covered by plan. We're really excited. We've actually expanded our coverage with respect to some of prescription drugs, especially for some really important conditions, things like COPD, asthma, as well as diabetes. We're now providing a lot of medications at no cost to the member, which is huge because those can be really expensive to manage. So prescription drug coverage is a really, really important one as well. And then you look at kind of that core plan design. What does a deductible look like? What does a coinsurance look like? We've got some different types of plans that we call copay plans, but essentially they create a really predictable environment to operate in, so you don't have to worry as much about coinsurance and things like that, but you know exactly what you're going to pay when you go into the doctor's office, which is really, really slick.
Yeah, incredibly beneficial. And you had mentioned lowering premiums. There's a couple of things you just mentioned I want to hit one more time.
Sure.
I don't want it to fly over anyone's head, because when you can lower a premium, that can help lower cost, right?
Absolutely.
And so many people are worried about the cost of things right now, gas, groceries. So when they're looking at their health coverage, there might be an option for them to help save, right?
Yeah, no question.
Yeah.
And it really starts with that subsidy that I was talking about. The majority of Idahoans qualify for some sort of a subsidy. In many cases, their premium is nothing with those subsidies. But it's really important to work with folks. And that's the best news. You don't have to go at this alone. We've got resources. There's a remarkable agent community. Your Health Idaho is there to help as well. And then beyond that, you can look at plan design options that save money. Things like no-cost telehealth. It's not only convenient, but it's also going to save you money as you use the benefits.
Yes, and convenience is so important as well, too, because time is also money.
No question.
Right? Okay. And then you had mentioned those expanded benefits. I want to hit those one more time because there may be some clues in there that could also help somebody get the coverage that they need for themselves or their family. So tell us once again more about the options.
Yeah, there's a lot of extras in plan designs now, which are becoming more and more, I think, relevant. So you've got your core medical plan, but then there are things like gym reimbursement, where you can get your gym membership paid for. Again, telehealth is a big one. Being able to access primary care, urgent care, even mental health coverage at no cost and in a really convenient way. We also have some tools to help save money on prescriptions that go in and look and make sure you're getting the best deal and saving as much money as you possibly can on your prescription drugs as well. So it's really important to look at those details, and that's where agents can help advise folks can call us directly, and we can help them kind of get beyond just the surface level benefit design.
Great, and I'm so glad you mentioned that because that's a lot to navigate,
No
right?
doubt.
You can lower your premiums, which a lot of people want to do.
Yep.
You got the expanded benefits, and being able to navigate that and figure out what's the right fit for you can be a little intimidating. So they
A
can
lot.
reach out to a professional for help.
Absolutely.
Okay.
Yeah, and there's a few different resources. Your Health Idaho is fantastic. Their website allows you to shop plans across different insurance companies. We also work extensively with insurance agents. If you have an agent, reach out to them. And I mentioned that deadline before. You also want to make sure that you're getting after it as quickly as possible,
Yes.
because the longer you wait, the harder it is to get that time. And then, of course, call us. SelectHealth, we're absolutely committed to make sure people are making informed decisions that make the most sense for their unique situation.
Wonderful, and that number too is at the bottom of your screen.
Yeah.
Thank you so much, Trent. Greatly appreciate all that you offer to help those make sure that they're making the right decisions for themselves and their family.
Thanks for having us.
All right, everyone stick around. We got a lot more to come right here on Idaho Today, right after the break.